Hello everyone, this is Mac here and I welcome you all to my YouTube channel which is called Maclogs. Well, who am I watching? Who am I seeing on my screen? Dr. Gopala Krishnan. Well, not many people know who he is, but let me introduce him. He is my childhood friend and I'm meeting him way after 25, 30 years ago. Wow, that's an amazing journey. Uh, Good evening, Bala. Especially good afternoon in Canada.
Thank you, Mashroor, for that introduction. Yeah, it's been more than 28 years since we met in person. It almost feels like yesterday. The
Well, I
childhood
totally agree
memories,
with you.
especially our
So
school years in Muscat, Oman.
yeah, we all grew up when we were hardly 10 years old, 11 years old. So today we are professionals watching each other, and we're going to be adding value today because the field which Dr. Bala is, that's the medical and the dental industry, which he's a professional about. And Dr. Bala Gopala Krishnan is an amazing doctor sitting in Canada. So, Bala, please go ahead and take over and let my audience and your audience sitting in you, we want to know who is Dr. Bala. Go
Thank,
ahead.
thank you, Mashroor. Thank you for that wonderful introduction. My name is Bala Gopala Krishnan. As you're aware, Mashroor and myself, we studied in Muscat, Oman. And after that, I immigrated to Canada in Toronto. I did my high schooling and also went to York University, did my Bachelor's of Science. And then I went to the Caribbean to do my Doctor of Medicine degree, MD. And then followed by, I did a residency and then master's in public health at Bloomberg University at John Hopkins. And then my interest was actually in teaching students. So I started, becoming a lecturer, then also assistant professor. And then an opportunity came where I was able to, partner with my former dean of medical school and co-found Nucleus University School of Medicine and Dentistry. As we are aware, in the Caribbean, there are many medical universities, but we are the only one with medical and dental faculties. And in the next semester, we will also be adding the veterinary faculty also. So we want to make sure that, especially this is our university is located in Aruba. It's one of the safest and, five-star islands in the Caribbean. So very, very many people, they want to visit Aruba, but if they want, if they could study medicine and become doctor, that's even a better opportunity for them. And so just want to talk about the current medical and dental affairs here in North America, especially US and Canada. As you are aware, after COVID, 2 years of lockdowns and so many, things that happen over the years, many medical and dental professionals, they were already, planning on retiring, but because of the present situation, many of them were overworked and they're tired and they went into early retirement. And because of that, and also even before that, there was shortage of doctors in Canada and US. So within the next 5 to 10 years, it's actually the situation is actually going to get even severe and worse. And as you are aware, the present situation in Ontario, they some of the emergency room they have to shut down over the weekend because they are unable to find doctors or supporting staff like nurses and technicians because they don't have enough staff to with the staff in the emergency room. So because of that, the healthcare, especially in Canada and also in US, it's actually deteriorating because of staff shortage. So that's where, our university comes into play is basically we are just supplying the demand. At the same time, we make sure that the quality is not jeopardized in any way. So all the doctors who graduate from us or dentists, they will be undergoing a thorough assessment every semester, and at the same time they will be provided with the best clinical rotation in the US, some of them affiliated with John Hopkins University programs. and they graduate from that program, and they are able to write the licensing exam in US. In the US, it's called
Well,
the.
before you proceed further, Bala, I would just like to add one question here that would be for the audience. Maybe you can answer that. That
Sure.
all the Asian students sitting in Pakistan, India, Bangladesh, Sri Lanka,
Yeah.
or even in Middle East, right? If they want to pursue the medical as their careers and they want to move to Canada, what is the best and the right option for them to pursue? And why would they select Canada as a medical field to become doctors in different sectors like dentists or for the cardiologist or any other related doctors professions and all. So please go ahead and answer that
Yeah.
first.
Yeah, sure. So obviously, as you are aware, the quality of life in Canada and US is much higher than the Asian countries. So if they are migrating to Canada, they might as well become a full-fledged doctor or dentist rather than going into any other careers or job. So my advice is, if you are a student who's considering becoming a doctor or dentist, I would recommend taking the pathway of going to the Caribbean, doing your medicine, and then coming to US or Canada. The reason for that is many students, they have gone to, for example, Ukraine, Russia, Poland, some of them in the Middle East. The problem is when they apply for residency in US and Canada, they actually look for clinical training in US or Canada, so which they lack because they have been trained in um, other places than the North American clinical setting. So that is actually very important when the students want to apply for residency here. So going through the Caribbean route, all the students, they will be able to do their clinical rotation in the US, and they will be able to settle in US, or they could also come to Canada and settle down here, right?
Hmm. That's amazing. As you mentioned earlier, that you have been a dean of Nucleus University as well in Canada. Am I right?
Yes, yes. So
Okay.
basically,
And how many students and what is the faculty or what do you call the total number of students attending this university and what is the greatness about this university?
So the beauty of our universities, as you're aware, our university began operations last year in 2021, and already we have enrolled around 50 students in medicine and dentistry program. And we want to be a university which caters to students not by numbers but by quality. So we don't admit more than 30 to 40 students maximum per class in
I
each
see.
batch. Many universities in the Caribbean, they actually admit 500 students, and they all sit in an auditorium listening to a professor, and they don't have the interaction with the teachers or the lecturers uh, that they want to do. So my,
So, so
my
your focus
principle.
is mainly on the quality of being having a less students so that in a, what do you call
Exactly.
the dean can focus on all the students equally.
Exactly, and we want to maintain that the all the students are taken good care of, and making sure they learn well, and and become full fledged doctors once they graduate from our program.
Any success stories of your students which you would like to share with the audience to know and maybe encourage them that who are those students and where
Yep,
they are currently after graduating from your university to become a great doctors?
yep. Our university, as you are aware, the maiden batch has been is into the second year out of the 4-year program. But
Hmm.
I have many success stories from the Caribbean, students who have studied in the Caribbean. One of my colleagues, his name is Dr. Daniel Horowitz. He's working as an internist at a hospital here in Newmarket. And also one of our old our batchmates, Dr. Siva Balasingam, Shiva, right? So he's also practicing somewhere in New York
Oh,
as a.
really? Shiva, where is he?
He's in US. He's
Oh,
practicing
okay.
as an internist. So
Wow.
there are many. For example, the doctors who practice here in Toronto, around 20 to 25% of the doctors are from the Caribbean. They have gone out of the country to do medicine, and then they come back and write the licensing exam, do the residency, and they practice here. So there are
Mhm.
great, success stories for doctors who have graduated from the Caribbean medical system.
What difference do you see in Canada and US compared to the medical field from
Yeah.
the Middle East or from the Asia, which is lacking among the doctors in this current scenarios?
Um, I mean, as we are aware, in terms of technology and the pharmaceuticals that's been used in North America is of much greater, I would say, quality than what's being used in the Asian countries. So some of the best or the newest equipments that's being developed for being used in healthcare that's actually being tested here in North America. But afterwards, only it comes to the Asian countries. And at the same time, some of the pharmaceutical drugs, they are first, released as brand name drugs. For example, one of the companies is Pfizer. Many of you are aware because of the COVID vaccine. They actually trademark their patent, and they will not let the Asian countries. Some of them, if you have the money, that you could afford it, they will be able to release it. But they take many years to change from a brand name drug to a generic drug, so they will be able to sell cheaper. So some of the Asian countries, they wait till and those patents finish. But if you have the ability to pay, you are able to make use of those medication. But in terms of the practice of healthcare, in terms of doctors, as you are aware, the US especially is a very litigious society. So basically, you had to be very careful with how you deal with the patients, because you could be in for a lawsuit if you have like a malpractice. So you had to be on a daily basis watching your back, to be careful, how you practice. You had to have records of everything that you do on a patient. You had to have proper consent from the patient, right? Unlike in our countries, the doctors are given higher authority. Here, doctors are kept to the same standard to make sure that the standard of care is not jeopardized.
I see. And I totally agree that with you.
Hmm.
And how do you see the life of people after COVID is not almost over, but sometimes because with the age people with more than 50, the age and all,
Yeah,
they do get the
yeah,
COVID effects and stuff like that. So where do you
exactly.
see the life of the medical going after the COVID? After
Yeah.
COVID and all.
I mean, like COVID just, I mean, it's still the many variants are in present. So COVID is not done, but the pandemic has been, downgraded. But, the after effects of COVID, they say it takes even many more years before we find out, the after effects of COVID and also the vaccination process. So it's an ongoing process. So we are actually carefully monitoring and watching, what's happening in the general population. But it's an ongoing issue that we have to focus on.
This is a very tricky question, but I'm sure you will have the answer for it since
Yeah.
you are in the dentist field as well, right?
Mhm.
Why do dentists make more money than other doctors?
So basically, you have to take a look at dentistry versus, let's say, a family doctor. A family doctor, basically, his work is to diagnose and write prescription. As in turn, a dentist, he actually puts in manual labor. He puts basically he's a surgeon. Dentist is a surgeon, so he has to do. So it's in North America, it's called fee for service. So every procedure you do, you actually get paid for it. So as dentists, whether it's root canal or doing a bridge or, filling the cavities, he's actually manually, doing a procedure. The same thing is applicable. Let's say if you are a surgeon and you do each procedure, you will actually get paid more than the dentist. And, if you
Are
are,
you a full-time dentist as well?
no, I'm not a dentist. I'm actually a MD, but my father is a dentist.
Okay.
And so I see how much and at the same time, working in the mouth, it's a small cavity and it's actually very strenuous job also. So just because of the money, it doesn't mean that it's easy. It's a
Mhm.
very tough job.
I agree.
Yeah.
But again, they say
and
Dentist
and
is
at
a
the same
different
time
field.
at the same time you also have to understand the dental equipment itself is very expensive. One of the
Mhm.
dental chairs is as expensive as a Toyota Camry if you want to buy brand new. So it costs over 30-40,000 for a dental chair. So, and also the dental filling materials, all the wires for the braces, they're all titanium
What
material.
is the what is the best advice you have given to your students when they come up to you for any advice to become a doctor and serve the humanity in different countries?
Yeah. So my advice to my students is do become a doctor or dentist if it's your interest in becoming, not your parents or your siblings' interest. So if you are interested in becoming a doctor, then you pursue it, and at the same time you work hard for it, and you achieve it, and never give
I
up.
I think to become a doctor, you need to be brave emotionally from inside.
Yes. Hmm.
Sometimes doctors
Yeah.
are very emotionally attached to the patients, but then again, when they take the patients to the surgeries or for the treatments and stuff,
Yeah.
they have to be very brave enough to understand the organs inside. And, whatever the treatment it is, the doctors are very brave in those terms. Do you agree?
Exactly. Yeah. No, I do agree with that. And at the same time, they are being trained, right? So you don't become a doctor overnight. So 4 years of MD studies, 3-4 years of residency, and many sleepless nights. Sometimes you work 24, 48 hour shifts. So all these actually builds you up into a strong person or a human being. And that also is partly the training itself is it actually modifies your personality, and that's who you become.
What, what is the objective of Dr. Bala in his life, and where do we see him in future doing what?
So basically my objective in life is educate as many students as possible in medicine and dentistry, and I want to see them go out in the hospitals and help many patients as possible, and I want to see my students succeed, and that what gives me the gratification, and that's what I'm striving for.
Which is the difficult surgery you have any time of your life did it, and why, and what was the success rate of your surgery?
So basically, I'm not a surgeon, but I have been, during
Mhm.
my clinical rotation, seen many procedures and assisted in many surgeries. And I think one of the difficult surgeries that I have seen is, um, I mean, like, it's not the difficultest surgery, but they have the procedure that we were doing is appendectomy. So basically, the removal of appendix, and especially if it's inflamed. Uh, the problem with that is usually if it's inflamed, you first had to give antibiotics and try to decrease the inflammation before you do the procedure. But sometimes if the appendix bursts, you have to open up the entire abdomen, and you actually have to take out the appendix, and at the same time clean up the entire abdomen with antibiotic solution. Otherwise it could actually become septic. So that's one of the procedures where I was really interested in assisting in.
Any plans to expand your expertise into US, UK, Europe, Asia? Any plans for that for future where we can see Dr. Bala
Yeah.
serving different nationalities and different countries?
Yeah. So as of right now, my field right now is in education. So wherever, students, want to become a doctor or dentist, I'll be there to, facilitate them. So even though our university is presently located in Aruba and catering to US and Canadian students, maybe in the future, we'll be opening up campuses in probably in UK or Asia and Dubai, where our the education could be promoted to the local population, and also for the Asian population to gain the knowledge. And also we will be more than happy to take in students from different parts of the world to come and train in our university, and also do probably masters in the respected field.
I think you should start attending or maybe being part of the conferences, the medical conferences, where the Asian doctors can tap on
Absolutely.
you for the talent and to
Absolutely.
understand exactly where the technological differences are. We know US and
Yes.
Canada is way ahead of Asia and Middle East, but there's no, I don't think there's any depth, in terms of the expertise. There's a lot. I'm
Yeah.
sure many are talented, but I think need to collaborate with Asia and Europe, with Canada and US. Do you agree?
Absolutely, I absolutely agree. Because the talent is there to be shared. So I mean, in the future, many countries must come together and work together. Especially one of the ideas I could give you is when the world get together to work on international space station, especially exploring the space. They all get together and work together and create a international space station. But I think the similar fashion. Oh, and at the same time, the world came together during COVID, right? They actually developed the COVID vaccine, and they were able to get rid of COVID. So similar approach should be given to all aspects of medicine, in terms of collaborating with all the countries.
Why do you see the government hospitals going down in terms of quality and the private sector? I mean, in the private hospitals, which have been created by different enterprising people, to have the hospital as an institution.
Yeah.
Why is such a huge gap and a difference between a government hospital and a private hospital?
I mean, Mashur, it all boils down to one thing, right? It's money. So the government basically, is not adequately providing the funding to the government hospital to, provide the best services. And at the same time, even if they provide the adequate funding to do the services in some of the Asian countries, a lot of administrative staffs, they don't allocate the funding where it's needed, right? But in the private sector, the people are actually paying money. It's a fee for service procedures, and whatever the money they are paying, that's what they're getting in terms of service. So the private sector is booming because of that, and then the government sector is actually going down because this misusage of funding and resources by the administrative staff in the hospital. That's one
Do
thing
you
that we could discuss about.
well, I've been to US and Canada, but I don't find any much difference in the government hospital in Canada or US with private hospital. Okay, there might be a little, maybe
Yeah,
slight 10 to 20% difference, but in Asia and Europe, there's a
yeah,
huge gap. You
yeah.
agree, right? There's
Yeah,
a
I do
huge gap in
100%
that.
agree. But in Canada, it's mostly the government based hospital system. So we don't have a private system here in Canada. But in the US, the existence of both private and government facilities is present. And as you mentioned, the difference is not as drastic as the Asian countries, but there is still difference in government run hospital and private run hospital in the US also.
What is the best message you have got from your patients in Canada that they want to be treated by Dr. Bala only?
I mean, every patient, basically, before you treat them as a patient, you should treat them as a, individual being and a human being. You had to give respect, and
Mhm.
that is very important. And if you could do that and treat the patient not physically but also mentally and spiritually, all three, because as humans we are made of mind, body, and soul, and they come to you because of a physical ailment, but there's also spiritual and mental being that's coming to you. So make sure you treat all three of them, and they will be fully satisfied, and they will always be coming back to you.
So, do doctors get the break to spend quality time with their families, or 24/7 they're with their second wife, which is their profession?
I mean, it's a lifestyle choice. I mean, yes, being a doctor is it's not the easiest profession, but I always have to have balance between work and life, right? So you have to balance yourself and pace yourself, and you have to be, work according to that. Otherwise, if you overwork yourself, you're actually going to be burned out. So that's not something you want to get into. So even from the beginning, make sure you allocate some time for yourself, and at the same time, allocate time for your family life also, and make sure you take care of your patients, at the same time also take good care of your loved ones too.
Okay, now this segment which I'm starting now is my favorite segment because this is where we're going to touch your personal aspects. We're going to find out Bala, I know from grade six, has he changed much now in terms of his personal likings and dislikings? Because that's where we want to find out. As you can say, more of a rapid fire, right?
Mhm.
Just to understand my guest and the audience connecting with you a bit more to understand how your life has been, all these years. So, Dr. Bala, I know that you were never a sporty guy. You were always not into sports much. Have that changed much, or you are into any sports other than being a doctor?
I mean, it hasn't changed much, that I would say. But after leaving Oman, I was interested in cricket and then also in basketball. So I, played that while I was in high school, and and then more than playing, I was more into watching those sports. So not much
If
has
I'm not
changed.
wrong, you were in Sapphire House. Am I right?
Sorry, in
You were in Sapphire House, right? Ruby,
Oman.
Sapphire, and Emerald,
Yeah, yeah,
the blue color.
yeah. The Sapphire, yes.
See, I remember. I remember my friends, everything. Okay. Favorite color?
Blue.
Why?
I don't know. Since little, that's the color I have been liking. So that's what.
That's amazing. Favorite food?
Favorite food, biryani.
Biryani. Let me tell everyone now that this guy loves halwa puri and he always keep asking me on Sundays, did I had the halwa puri in Pakistan? Because I'm waiting for him to come to visit Pakistan so he can enjoy the halwa puri because he loves halwa puri too.
Most
Am I
definitely,
right?
most definitely, Mushroom. I
Definitely.
sometimes when I have free times, I watch the YouTube, the foodie videos, and I see some of the amazing foods coming right out of Karachi, Pakistan, and Peshawar, Pakistan. Best food.
I am waiting. And another secret to be revealed for Dr. Bala is that he can speak Urdu as well and Hindi as well. Am I right?
Um, little,
Yeah, he can. So let's hear a little bit Urdu from him. He's basically a Sri Lankan born, but he's a very dear brother and buddy to me all these years. So Assalamu alaikum, brother Bala.
Assalamu alaikum, Mushroom. Kefalik.
That's Arabic, not
I don't
Urdu.
know.
So let कैसे हैं आप? ठीक है?
कैसे ठीक है ठीक है कैसे है आप
Okay. So basically, that was a little bit just for a little humor. He knows a little different languages as well. He speaks Tamil, he speaks English, he speaks Urdu, and a little bit Arabic. Am I right?
yes little bit Arabic
Any
and
other language which I have missed out? Would you like to say it?
since we live in Canada, we also speak a little bit of French. Bonjour,
Oh,
comment
okay.
ça va?
Okay. A positive message from Dr. Bala coming in Tamil language would be an ideal way to hear from you. How would you say all the best to everyone out there in Tamil?
um, எல்லாருக்கும் எனது நல்வாழ்த்துக்கள். um, எல்லாரும் um, சந்தோஷமாகவும் um, மகிழ்ச்சிகரமாகவும் um, வாழ வாழ்த்துகிறோம்.
MashaAllah. So, Bala, do you have any thoughts, any thinking about MacLux? What do you think about MacLux? Where it's heading and what is it?
So
How do you like it? Do you
So
watch it?
much true, since the launching of Mac Vlogs, whenever I have time, I watch most of your episodes. And I have found out, since the beginning, every episode you have been creating, it's actually, I see an evolution in progress. and I see that you're getting much better at what you do, and you're keeping your fans very well entertained. And at the same time, I'm wishing you the best, and I'm hoping to see you hit the 1 million mark very soon.
Oh, well, well,
And
well. Thank you so
and
much for such a lovely and kind words. Let's
and
hope
also,
so.
and also, congratulations on your winning of the Heroes of Pakistan YouTube award. I think you very well deserve it, and
Thank you so much once again. So why don't you give a shout out to MacLux for all your audience so that they can come forward and subscribe and be part of this journey of MacLux where they can express themselves in different professions or different life of wherever they're living in around the world.
absolutely, yeah, I will do that.
Go ahead.
Okay. So everyone who's watching out there, make sure that you subscribe to Mac Vlogs. And Mushrooms is an amazing host. He's the winner of your, Heroes of Pakistan's YouTube award winner. And please make sure to subscribe and click the notification button.
Thank you, Bala, for being always such a great chap, great buddy, great brother, and a great family to me. And we have been constantly in touch. So that's the best blessing. I can always say thank to my Allah that He had connected me to you. You are a brother from another mother. But we have been all these years, whether we were young kids, now we are in adults, we're leading our lives, but I'm feeling truly, truly blessed that Allah has given me a great friend like you who constantly been in touch with me, and that really matters the most. Basically, the money and the other work which we do will keep on happening, right? But the best part is the connection which we really need to make it stronger each day of our lives. Basically, because we don't know how long we're going to be surviving and we're going to be living, right? So we these small special moments, the small moments, really need to share about, and I'm sure we can tell our kids in future. God really connected us to very beautiful people like you and the other classmates, which we are still in touch with.
And one more thing I want to add to Mashru, since our, the Sri Lankan school times, Mashru has been the bond that's keeping everybody together. Because even though it has been many years, because of you, you have created the WhatsApp group, the Facebook groups, and you have been constantly, making sure that every one of us interact with each other. So it's a God's blessing, Allah's blessing that He has given us a wonderful person like you, who is actually always caring for others, showing love, and always encouraging all of us to be the best and to do the best as much as
Alhamdulillah. Alhamdulillah. Thanks to Almighty Allah, He chose me with my little nature and the value system from my parents, so I feel really obliged and happy and blessed, because I feel that spreading love and care and connecting everyone around the world, that matters the most, basically, because we all are in busy schedules and busy life of ours, but we never get time to even say hello or hi or assalamu alaikum, so that's really important. I feel that's why I always feel that everyone should be connected, connected,
absolutely,
basically, because
absolutely.
because until and unless you don't stay in touch, there's no meaning of life. The life should be very beautiful. That's what Allah says, make it
Exactly.
beautiful.
And at the same time, every person you meet, every person you acquaint with is already blessed by God. So make sure sometimes
Alhamdulillah. Thank you once
sometimes
again, Bala,
and
from your weekend, from your busy schedule to add value in MacVlogs and to be part of MacVlogs family, which you were for many years. But again, today I got you on MacVlogs this evening to add value in other people so that we can change their mindsets a bit. That what is the profession of dentists and the medical education which people really require to become a great doctors to serve the humanity. So you really are a truly amazing human being and a professional doctor, which I really feel respected. And I give a salute and thumbs up and cheers to you for doing a great work. So keep up the great work. So I'm sure many young youth, boys and girls, would look up to you, learn from you, and come to Canada and learn as much as they can to take the best advantage from you.
Okay, thank you so much for this opportunity, Mushroom. You have been a wonderful host and a wonderful friend.
Inshallah. So get
Thank you so
ready.
much.
I'm coming to Canada soon. So we're going to be having a great time in Canada for a road
Most
trip for sure.
definitely, we are looking forward to it.
Definitely. And if you're coming down to Asia, Dubai, Pakistan, Sri Lanka, even, let's get together and just make it a great time together. Okay?
Absolutely.
God
Thank
bless
you.
you and your
God bless
wonderful
you too.
family. Take care. Keep
You
that
too.
smile on. And let's see.
Thank you.
So, everyone, that was Dr. Bala Gopala Krishnan, all the way from Canada, Toronto, for you. Just keep on waiting for new guests to be arriving, maybe tomorrow, maybe day after. So that's amazing. Thank you, everyone. See you next time. Till then, keep subscribing and sharing MacVlogs. Take care. Bye bye.